Kia ora koutou katoa. Today I'll go over Cabinet's decision on alert levels for the parts of New Zealand outside of Auckland. But first, I'm going to hand over to the Director General of Health, Dr. Ashley Bloomfield, to update us on the latest numbers in case those watching at home have not had a chance to look at the press statement earlier today. Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So you may have seen today's numbers already from our 1 p.m. media release. The key figures for me to reiterate today are there are once again 20 new community cases of Covid-19, all are in Auckland, so our total number from this outbreak is now 821. The total number of community cases this morning, as at 9 o'clock yet to be linked, was 33, a small rise on yesterday's numbers, but investigations continue through the day and that number will continue to fall. Our analysis of yesterday's 20 cases that were announced shows 18 of these, or 90%, were contacts of known cases, and of these, 14, or 70%, were household contacts who were already isolating. 5 of the cases overall were infectious in the community in one or other place. All these numbers are moving in the right direction, which is reassuring. I'd like to just take the time to once again thank everyone who is a case and who has moved into one of our quarantine facilities as part of the management of this outbreak. It's a sacrifice and a commitment, and it is keeping the whole community safe, so I want to thank you. Of our very close contacts, 99.9% have been followed up by contact tracers, and efforts to reach the remaining person are continuing. Around 86% of all contacts have been followed up by our contact tracers, and we have already had a test that is in our system, and our public health units around the country are following up those for whom we don't have the results yet. Now, yesterday there were 4,750 swabs processed around the country, and there were just over 2,000 swabs taken in the Metro Auckland region yesterday. This is our lowest testing day since the start of the current community outbreak. The falling test numbers reflect, in large part, a big reduction in people with symptoms. This is the impact of the lockdown on stopping all respiratory illnesses from spreading through the community, and in addition, that we now have very few new locations of interest emerging. However, testing remains central to us being confident that the outbreak is under control. Our most important message today is if you have any symptoms, you must get tested wherever you are in New Zealand. At the start of the outbreak, we focused our testing heavily on those who had contact with cases or who had been in locations of interest. We know there are fewer people, as I said, with symptoms, but getting tested if you are symptomatic is still the most important thing. Everything else is supplementary. Over the next week, our goals are to improve our confidence there is no undetected community transmission in Auckland and to protect the rest of the country from any possible leakage of the virus out of the Auckland region. And there are 3 key actions that will help us achieve these 2 goals. First, we will, of course, maintain a network of testing sites across Tamaki Makaurau to ensure timely access to testing, including for, of course, our Māori and Pacifica communities. The Northern Regional Health Coordination Centre is continuing to look at the best places for our testing centres, and they will move, in particular, to ensure they are reaching into places where we've seen cases in the previous few days in South and West Auckland. We will also be working closely with relevant employers to ensure that they support their essential workers in not coming to work if unwell and they are waiting for a COVID-19 test result. Second, there will be more regular surveillance testing for healthcare workers who've worked caring for or on wards or units with COVID-19 patients in our hospitals in Auckland. This will involve both immediate testing and ongoing surveillance testing for the next couple of weeks. In addition, we are increasing the frequency of testing of staff who are working in our quarantine facilities in Auckland for the next few weeks. Given the large number of cases in there and what we know about the Delta variant is that people are shedding more virus than they did with earlier variants. So, and we have workers who are crossing the Auckland boundary to put in place weekly testing of those workers. This is part of our overall efforts to fully control and end this Delta outbreak over the coming weeks. We have started engaging with employers and industries whose workers are affected. Now, because this is surveillance testing, that is, these people don't have symptoms, they will not be required to stand down or stay at home while awaiting their result, unless, of course, they have symptoms. And likewise, just as for other testing, there will be no cost for this testing. We are still working through the details, but the key point is essential workers crossing the Auckland border will be expected to have had a test in the last 7 days and be able to show proof of this. We're finalising how we will provide people with this proof, and it's likely to be an email or text message that they will be able to show at the boundary. There will be spot checks there to ensure people are getting this weekly testing done. We know there are around 3,000 essential workers who are crossing the alert level boundary each day out of an estimated 220,000 essential workers in Auckland. In the first instance, this testing will be available, of course, as our nasopharyngeal swabbing at any of the community testing centres in Auckland and at general practices and urgent care centres. However, we are also working with the provider in Auckland to enable saliva-based testing to be rolled out and available over coming weeks too, to support that effort. I would like to thank all essential workers for their
country. We need you to be tested. It's why we ask our contacts to isolate and be tested. And it's why it's so important that anyone working, particularly at Alert Level 4, stay home if they are sick and get tested. We also want to increase our testing of people who are crossing the Auckland boundaries to ensure we don't see any spread beyond Auckland. You'll have heard Dr. Bloomfield talk about this. To ensure the safety of those in lower alert levels around the country, we want to step that testing up. And that's why, as has been said, all workers who are permitted to cross the Auckland boundary will be required to have evidence of a test taken within the 7 days before crossing. And as has been said, this will be a requirement from 11:59 p.m. on Thursday, leaving time for people to go ahead now and get a test. Because this is surveillance testing, people will not be required to stand down or stay at home while awaiting their result if they are an essential worker. We're also asking those who are permitted to travel for personal. Schools and other education providers will be given the next 48 hours to prepare to reopen from Thursday morning. As we have today, Cabinet will review the levels for the whole country, including Auckland, at a Cabinet meeting next Monday, 13 September, and announce any changes that same day. These changes mean we'll have one part of the country at level 4 and the rest at level 2. For the most part, that is workable with the hard boundaries we've set up, but it does pose challenges, particularly for Northland, who essentially become cut off from the rest of the country. I want to assure Northland that we are working through those issues. There will be the ability for people to travel through Auckland if someone in Northland, for instance, needs to get to the Waikato for their work. People will need to travel directly without stopping while going through Auckland. You'll also need to carry evidence of the purpose of travel and the location where you are travelling to. The ability to keep moving down levels across so much of New Zealand is testament to everybody's hard work, but it doesn't mean we're out of the woods. To account for Delta, level 2 will be different to how it's been before. As I've said many times, Delta has changed the game, so in order to beat it, we've had to adapt our game plan too. I want to recap on some of the changes we've made because of Delta that will mean level 2 is different than what everyone may recall. But even in places you are not legally required to scan in, my advice is, of course, do it anyway. What we've learned is that traditional contact tracing can't keep up with Delta. The virus is too fast. So record keeping and scanning continues to be our best tools to quickly track down any potential spread of COVID and keep us out of lockdown. It's also one of the best means we have of reducing the time we need to spend in lockdown. So again, please scan in. Mask wearing and scanning are rule changes we've made in advance of this latest outbreak, but this will be the first time that they've been put in place. At the same time, though, there are other things we've recently learnt about Delta that have caused us to take another look at the Alert Level 2 settings and ask if there's anything more we need to change. The biggest issue is this. Because Delta is more transmissible, we're much more worried about big groups of people. It's now no longer just whether you have enough side. We're now bringing these venues into alignment with the rules that exist for retail and supermarkets, which is 2 metres. That again will just mean we have fewer people in a venue, with the number being dependent on the size of that venue. It's a quick alignment that we think in a Delta environment makes good sense. So a quick summary: wear a mask, scan everywhere you go, and be mindful that when you visit some places, they will have rules around how many people can be inside at any given time. Be patient, be kind, and support local. These are tough times. Moving to level 2 is progress, though, and it is positive, but it comes with a warning. We've done so well to get this outbreak under control. Level 4 restrictions are working, but the job is not done. We're within sight of elimination, but we cannot drop the ball. For the full details of the new level 2 settings, Delta 2, visit covid19.govt.nz. We're now happy to take questions.
Prime Minister, will any of these new restrictions be carried over into Alert Level 1?
Well, I think the first thing that I would say is that actually when I've spoken to our public health officials around Alert Level 2, they still absolutely anticipate that if we continue to make progress, that we will get back to a 1 environment. But what we will do is the same that we've done with every alert level. Take a look at
People who haven't had that requirement on them before
I think the first thing, the most important thing I could say is that we've learnt from experience. You can see from this outbreak that unfortunately it's the social events where people know one another, where they're indoors for long periods of time, where they're socialising, that we see spread. And you only have to look at some of the examples from this outbreak, and that's why it's so important. So I think education is as important as some of those harder forms of enforcement that people ask for, like security.
How is Auckland...
Oh, sorry, Jessica.
How is Auckland getting on with this 2020 over the last 3 days? How are they tracking to be reassessed on Monday?
Well, actually, we base all of our decisions on public health advice, so perhaps I'll bounce to Dr. Bloomfield for that.
Thanks, Prime Minister. So, yes, it's a remarkable coincidence. It's been 2020. The key thing here is the proportion of those cases that are known household contacts and expected cases is increasing. And we will see more of them. So we're expecting more of those to come through. What we're really interested in is whether there are any exposure events amongst those new cases out in the community, and also cases that are unlinked. And I should say that so certainly for students 12 and above in secondary school settings, would be strongly recommending that there. And then I think as an option for younger children, if parents wish their children to be wearing a mask and they're confident they know how to, and of course that does raise issues about access to masks, but it's not a requirement.
Why not? Mandated it.
Yeah,
Why
not
mandated?
Well, at this point we don't think in Alert Level 2, first of all, where we wouldn't be Level 3, and indeed a Delta Level 4, you can see that the extent with which the contact tracing has gone very wide, and even under Alert Level 4, to consider everybody, virtually everybody, as at least a close contact, is a reflection of that changed approach because of Delta. I think all our advice around a Delta Level 2 has been taken up.
There was only one minor difference, but it just applied to the distinction around the criteria for personal emergency circumstances over who could travel over a Level 4 boundary. So it was very, very minor. And good reason, I think.
Provided your advice around what should be happening at Level 1, or are you waiting for Cabinet next Monday for that?
No, we haven't had any discussion.
That'll be this week's task. We do it on a week-to-week basis, so we'll already be turning our minds to that. And again, looking and seeing what other countries are doing, as well as getting advice from our team. Possibly without typical symptoms of COVID-19. And there's always a screening set of questions that are asked of people attending EDs under an Alert Level 4 where there's an outbreak on. The person was then admitted to hospital to the appropriate place for the symptoms they had, and the following morning the attending clinician, on further questioning, did wonder if COVID-19 could be a possibility, and so asked for a test to be done.
To that, and you've seen today, we've got one case that we've identified there in a house, in a large household, which means almost inevitably you'll see extra cases come through from that. So for us it is day by day, but day by day we are making very good progress. What I don't want to do is make the mistake of moving too quickly and then seeing a resurgence, because that has happened with Delta before. Did you have another one, Ben?
I was going to ask, on the 2D or Delta 2, whatever we're calling it.
Delta 2.
Delta 2, okay, thank you.
Emails and contact details we have, we use what we call our finder services. That includes any information that other agencies may have, including the police. And what we're also doing is, where we've got people with outstanding tests, the local public health units, if they can't get hold of people, are actually doing visits to the address that we think people are isolating at.
For these unlinked cases, obviously there's a bunch every day that kind of gets sorted out in the next 48 hours. But there are some, it seems, that are
Position to share a bit more on that tomorrow.
on the Auckland, on people traversing Auckland to get to Northland or to get from Auckland further south. Is there going to be, what are the rules? If that is about 2 hours, probably driving, getting into traffic, are they going to have like a time limit? Is going to be
Sorry, for people when they're transiting through. Yeah, so look, we've been in this position before, and really I think the request that we have from those in the north is just to allow access to other level 2 environments, because in level 2 you are allowed interregional travel. So someone from Hamilton is allowed to move down to Rotorua. The same goes for someone in Northland. The problem is they just have a level 4 in between. So that's why we just ask them to bring evidence of where they're going and why, and just move straight through. And that will be key. Do not stop in Auckland. It is a level 4 environment, lest you want to end up being told you have to isolate. So keep moving through. Joe, I haven't had you, Thomas, and then I'll come back into the back rows.
Dr. Bloomfield, what
Places where the availability of pre-departure tests means that they do come straight in as well.
the only other
It is.
Yeah, look, I'm very happy to come back to you on that, and I, as in all these matters, take the advice of my public health team and the circumstances at the time. So I just need to get...
How your comments yesterday, though, and that decision don't seem to make much sense?
Well,
It is in the context, though, Joe. One of the things to keep in mind, those red flights, the proximity of their availability to bring people back, the 72 hours.
Māori are prioritised.
The most important thing for New Zealand is that everyone who can be vaccinated is vaccinated. And that means our health providers locally will use tools to reach out to their local patients in order to encourage them to be vaccinated. I've seen there's been a very swift reaction online to what David Seymour has done, and I think that's with good reason.
Further restrictions for large gatherings for the remainder of the year, so looking forward to Christmas, festival season, sports and musical events.
Look, no, at this stage we've really very much focused on that next stage of moving down into that Delta 2 environment and the restrictions we need there. But you can see what we're taking into consideration, the way that outdoor venues work versus indoor venues. The next stage for us is to look at what level 1 looks like, but our goal is, as always, to be as normal and as safe as we can be. Last one, and then I'll come to you, and then I'll
much. Are you confident that Gleneaglen Mosque was the most appropriate place for the terrorists?
Already gone through its substantial public consultation, so people had already had their say. We haven't needed to rush that process. Now what we'll do is go through the procedural process in Parliament a little more quickly. On the question of rehabilitation, look, we've put out in the public domain a large amount of information, but I do still think there's a role for those other reviews that we have, the coroner's process, the IPCA, to give us those extra insights into what happened in this case. Thomas, I think I haven't had one for you.
Would you like to see corrections provide more information about what programs or offers of support were made to this man?
Yeah. So look, I do think that that's part of the work that we need to do as we put out all of the agencies' responses. You may have seen that they have responded to some of the questions around, for instance, the mental health support and assessments, and for instance, the fact that that those were rejected, and some of the challenges that existed there. But I think actually overall, our goal here is just to provide all the information and be willing to critique ourselves.
You remain convinced that de-radicalisation attempts were made, or sufficient efforts were made?
I know engagement occurred, but I do think that there is room for us still to look in a little more detail across all of those areas. But keep in mind that would have been, there's a range of different agencies who have had a role all the way through, from the NZSRAs to the police to corrections, and so I think it'll be helpful for us to use those processes to draw that out.
Why couldn't he be deported under national law, though? I mean, if he's a protected person.
No, there are a few things that we can explore still. So I am just going to give us a bit of time to work through some of those options. They're not going to be, it won't be quick, but I think it does warrant us exploring, because most New Zealanders will say, well, if you acted fraudulently in gaining that status and you're a threat to national security, surely there are some mechanisms that we can use there. So that's what we're exploring. Yeah, Michael, in the front today.
I guess just back to COVID, sorry, and looking further out, realistically, how long do you think that the rest of the country, aside from Auckland, will need to spend at level 2 before going to level 1? And can you see a situation where Auckland could stay at level 4 and the rest of the country level 1?
We take every decision based on the data that we have in front of us, so we don't tend to get into those hypotheticals other than to plan and prepare so that we have all of the options available to us. So every day our health providers will send out messages directly to their clients, to their patients, and we undertake targeted messaging for our for patients all of the time. It's not unusual in a health program to do that. So to try and undermine that for no reason, in fact for all the wrong reasons, is hugely disappointing. Yeah,
sorry, just
go ahead.
In terms of mask use in schools, would you not consider schools to be more high risk than, say, 50 people in a nightclub?
No, not necessarily, actually, and for good reason. And one of the points that the Prime Minister made is that in schools, they're actually very controlled settings, and you know exactly which children in which classroom generally. When they're interacting most is when they're outside, usually during breaks. So, no, I wouldn't consider it a higher risk setting than a nightclub. And in fact, all the evidence, even without Delta, is that the highest risk settings are the ones where there is that amongst adults, close contact, and crowded and in confined spaces.
In terms of testing, with the increase in needing for tests, there's some health leaders in South Auckland who are calling out for saliva testing. Why is it not only until a couple of weeks' time before we see that? Why can't that be brought forward?
So the thing we've focused on, because it's the area we have got really good testing capability and capacity, is around nasopharyngeal.
At all, as we look at this case. Of course, we as government and as agencies, we have to reflect on ourselves, but that is not the direction I would encourage anyone to turn their minds. There was nothing but good faith there. I'll let you finish your question.
Just on that though, the NZMA president says he feels really upset because he feels as if Friday could have been prevented if corrections had continued through with their initial engagement with the NZMA, which is the country's foremost Muslim organisation.
Yeah, I think the only thing that I would say there is that you can see a pattern of reluctance to engage. And that I think was one of the difficult things throughout this period as well. But I can't speak to the engagement directly with those outside of government agencies. I just know that was a pattern. That border, very few places around the world have been able to maintain those different levels of restrictions, and this is one way that we can do that.
Prime Minister, what sort of improvements would you like to see in the number of cases or the types of cases to see either Auckland go down from level 4 or the rest of the country go down from level Delta 2?
So obviously you've seen that we've been willing to move down with the rest of the country regardless of what's happening in Auckland, and in part that's one of the reasons the border is really important to us. You know, I think in the past, of course, the fact that people, you know, in New Zealand we do move around a lot, we have a lot of transient movement, we have a lot of freight moving. So the border has been critical to us in making this decision. There's not too much movement, and we're putting in that surveillance testing. For Auckland, we've already set out what we want to see there. We want to see a good sense of containment, and that's what we continue to look for. Mystery cases are particularly important to us.
Could you move down a level if there were still, 10, 20, 30 mystery cases?
Oh, look, mystery cases, we do want to get a sense that if we have had them, so over the course of, several hundred cases, if you've had spaces, the swab spaces, that vents appropriately, they've changed delivery protocols, they've increased the separation now, so it's up to the wall. So there's been a number of changes, but there's also been a review around it as well, and our technical team have reviewed that. And Dr. Bloomfield, do you want to comment on that?
Just to reiterate, there's been a number of things done to just reduce any potential for residual risk, but a technical advisory group that includes public health expertise, and also a couple of our key scientists in the ministry have had a look at the report and are satisfied that any residual risk has been minimised to the greatest degree possible.
I'm going to finish down the back.
Thanks. Will there be tertiary specific guidelines for alert level?
Quickly, mask use at university, is that mandatory?
Minister, Dr. Bruce.
Right, yeah. Not mandatory, but I would strongly encourage it, and it would be a really good place for people to be using masks and scanning in.